May is Mental Health Awareness Month, and the message that you've likely heard during that time is for people to not suffer in silence.
But for many in the deaf community, silence isn't a choice. KSHB 41 News reporter Olivia Acre shows us how barriers in communication are keeping vital mental health care out of reach for some. Olivia?
Yeah, so for many deaf individuals, it's not about choosing to stay silent. It's about being unheard. So 15% of Kansas is deaf. I heard the voices of advocates here who say mental health care needs to change to include everyone, not just those who can speak.
When it comes to seeking help for mental health, common advice you may hear, don't suffer in silence, or it's okay to talk about it. But what if you can't?
Constantly being told no is something that you just get used to.
Cameron Szymanski was born deaf. His interpreter, Jasmine, voiced his thoughts for this interview.
Mental health services and getting any sort of support care, it should be prioritized.
The deaf and hard of hearing community don't have the same resources that the hearing community does, yet they face the same challenges.
Suicidality, self-harm, depression. The deaf community has higher incidences of that.
But the biggest challenge is language deprivation.
If they don't have full language, then they can't even understand their own thoughts and actions.
Kelsey Stock works with the Kansas Commission for the Deaf. There, she became an advocate for mental health after witnessing challenges faced by her own family.
When my son was 2 years old, we were trying to find a play therapist. He's profoundly deaf. I struggled finding a therapist who would be willing to work with us.
Stock and Szymanski think part of the reason is the lack of knowledge around ADA guidelines and the ability to get an interpreter.
It shouldn't be a barrier that you're providing an interpreter is the barrier for individuals not to receive these services.
There are only 3 signing mental health providers within 60 miles of Kansas City. Stock says that's not enough.
People who are deaf have to deal with this every single day, and it's exhausting.
The two want people to be aware of these issues and hopefully make mental health services easier to find, so the next time someone needs help, they won't have to suffer in silence.
Good changes are happening, but there are still barriers there.
So the American Academy of Pediatrics only began recommending sign language for deaf children in 2023. And so for Stock's family, her son is totally deaf. They use ASL and he doesn't have implants, anything like that. So that's why it was hard for them to find a therapist. And really the biggest shortages for ASL interpreters are higher education and healthcare. And that's kind of where a therapist would fall.
Yeah.
Wow.
Very tough.
I mean, you think about how many people don't seek out mental health treatment already for fear of stigma or whatever you put into it, but at least they have the option to do so whenever it's there. And then not being able to and not have the people around you, that's a double whammy for people in that situation.
Yeah. Stock is hoping this message reaches some providers. She will be presenting at the Mental Health KC conference later this week, some of what we talked about today.
A much needed story, Olivia. Thank you for sharing.